Good day and great health. My name is Dr. Chiropractic of Ohio Specific Chiropractic. I'm a pediatric, family wellness, and upper cervical specific chiropractor. Sometimes when I'm talking with patients or potential patients, a statement like this comes about. Usually that patient went to their medical doctor and started talking about chiropractic or asking questions about chiropractic, and the medical doctor might say, well, don't go to a chiropractor, they break spines. Please understand right out the gate that chiropractors don't break spines. This is a false statement. In fact, if we are providing a specific and scientifically accurate chiropractic adjustment, the force of that adjustment comes nowhere close to the need or the potential to fracture the spine. I'll talk a little bit more detail of the science behind that in a few minutes. Secondly, if chiropractic was breaking spines on a day-to-day basis, we truly wouldn't be the world's largest non-medical healthcare profession. Chiropractors see over 30 million patients every year. If we were breaking thousands of spines on a day-to-day basis, we truly wouldn't be in existence. Thirdly, then, makes you kind of ask, then, where did this misconception come about? There's always been misconceptions about chiropractic since the dawn of chiropractic, since the early 1900s, but they started to come to the forefront in the early 1960s when the AMA was actively creating smear campaigns against chiropractic and other non-medical healthcare professionals. They had a committee at the AMA called the Committee on Quackery. At this point in time in the history of the AMA, if they felt as you as a patient were trying to seek care outside of their established medical paradigm, you were bound to fall prey to an unscientific quack, cultist, or charlatan. And this is exactly what they called chiropractors. In fact, the chairman of the committee is on record saying that chiropractors and rabid dogs were very similar. We were both cute, but we both killed people. Now, this is this is slanderous speech, along with all the other things that were being propagated. But it took over 30 years of lawsuits filed by chiropractors until we won our day in court in 1987. At this point, then the U.S. District Court confirmed that the AMA was violating the Sherman Antitrust Act, and they confirmed that the AMA was trying to contain and eliminate a competitor through lies, slander, and other false information. The problem, though, is that these smear campaigns had been going on for 30 years, so already this misconception of chiropractic had already seeped through the educational systems of medicine, through society, and through culture. Now, if you still feel that chiropractic holds more risk to it than medicine, I like to point out some of medicine's own studies and some of medicine's own facts. One important study done at one of the most prestigious medical schools in the world, Johns Hopkins University Medical School, they did a study in 2016 where they found that medical intervention is the third leading cause of death in America. Not chiropractic intervention, but medical intervention. Medical intervention is associated with over 250,000 deaths every year. It's only behind cancer at number 2 and heart disease at number 1. Now, if you still feel that I'm kind of being hyperbolic in some of this information, there's nothing more concrete than insurance premiums. And as chiropractors or a medical doctor, we all pay malpractice insurance. And the premiums we pay are based on a few factors. The number one factor is based on the risk associated with that intervention or procedure. It's also based on the state you practice in, prior claims, and the experience of the doctor. In the state of Ohio, as a chiropractor, I pay on average around $1,500 every year in malpractice insurance. A medical doctor in the state of Ohio pays on average around $15,000 in malpractice every year. So if we just look at the numbers, there is a lot more risk associated with medicine than chiropractic. Finally, to kind of circle back to some of the science of how chiropractors don't break spines, they've done many studies to measure the force needed to fracture the spine. One study looked at the cervical spine and the force needed to fracture the cervical spine, and they found it took around 3,200 newtons of force to fracture the spine. That's around 720 pounds of force. There's been many studies done to look at the force needed to perform a chiropractic adjustment. And one study found that on average it takes around 20 to 90 newtons of force. That's around 4.5 to 20 pounds of force. So if we're just looking at the numbers, the force performed during a specific chiropractic adjustment is going to come nowhere near the force needed to fracture the spine. This being said, an adjustment needs to be given by a properly trained and educated and competent doctor of chiropractic. And finally, with this topic or any topic, it's always best to look at all the facts or gather as many facts as possible. At that point, it's up to you then to make a decision based on your best perspective. And that best perspective should be the health of you and your family. So your choices need not to be from medicine's perspective or chiropractic's perspective, but they need to come from the perspective that you want the best health choices for you and your family. If you have any other questions about this or concerns about any other topic, please don't hesitate to reach out to me on my website at ohiospecific.com. Thank you very much.